Welcome, everyone. Thank you for joining this AEI webinar on the COVID-19 epidemic and the future of global governance and international cooperation. I'm delighted to be joined by my AEI colleague, Dalibor Rohac, who's joining us from New York, as well as by our special guest today, Manuel Muñiz, who is the Deputy Foreign Minister of Spain, Secretario de Estado por la España Global. He is in charge of, roughly speaking, policy planning, comms, and economic diplomacy at the Spanish Foreign Ministry. Before entering public service, Dr. Muñiz was the Dean of Instituto de Empresas Public Policy School. He is originally a lawyer. Spent reasonable amount of time here in the United States. He holds an MPA from the Kennedy School and was affiliated with both Tufts and Harvard after that. He also holds a doctorate in international relations from Oxford University. So thanks to both of you for joining us. I look forward to this conversation. If you have questions for us, please send them through the various channels indicated on the event page. I imagine there is an email route, a Twitter route. I am hearing that some questions have even come in beforehand already, which is remarkable, and I commend you on your engagement. Let me kick this off, Manuel, by asking you to give us an overview of the situation in Spain as it has evolved over the past 3 months or so. Of course, Spain and next to Italy was one of the first countries in Europe really heavily hit by the pandemic, but it seems to have gotten it under control since. Can you just walk us through sort of the public health situation, measures taken to deal with the pandemic, where we stand now, and how the reopening is going, if you could. Thank you.
Great. So thank you, Stan, and thank you, Dalibor, and thank you to the American Enterprise Institute for the chance to have this conversation with you guys and to share our thinking and the way that we see things from over here, and to have this exchange of ideas. I'm sure it's going to be extremely fruitful and useful. So in terms of where Spain is at, so at the moment, we've completed what has been called here the de-escalation, which is basically the part of the exit strategy from generalized confinement, which is where the country was at for a couple of months, starting on the 14th of March. So on the 14th of March, the totality of the Spanish territory and the Spanish population was asked to remain home for the duration of the confinement. This was a very harsh measure taken to control the circulation and the spread of the pandemic. We hit the peak number of cases and peak number of fatalities roughly at the end of March. And then since the end of March, both of these numbers have been falling until roughly where we are at today, where we're in the single digits number of deaths per day, and the circulation of the disease has declined across the territory. So right now, Spain, if you look at the numbers, for example, what the ECDC, which is the European CDC, the Disease Control Center here in Europe, uses as a metric to assess the circulation and the prevalence of the disease in a given territory. So the attack rate, which is the average number of cases over the past 14 days per 100,000 population. I have the full list of countries here assessed by those numbers. Spain is now one of the safest places in the world. So the confinement measures and the strict isolation and social distancing measures that were taken have worked. Now, the challenge, and I'll go into very, very quickly the details of the measures that were implemented and our learning over the past couple of months about how you manage this disease, because it was very tough at the beginning because there was no roadmap. There was no roadmap as to how you navigate this crisis. But now, before I go into that, now what we face is a different type of challenge. So we have to live within this tension of, you increase mobility, both within the country, but also across borders. And we're in the process. We just opened our internal borders. So these are in Spanish terms, the borders with our European, EU, and Schengen partners. And on the 1st of July, the EU as a whole will open its external border back to a relative normality with a number of third countries. So we now have to manage this tension between the increases in mobility and what that does to the number of cases and the contagion rate. And that's basically what we're going to have to navigate for the coming months until there's an effective treatment or a vaccine for the disease that is both tested, produced, and distributed in numbers, in sufficient numbers for this to be effective. So that's where we're at, and this is the period that we're now entering. We enter it with some confidence that we will be able to manage what will surely be a number of new cases in different places, some of them through import, some of them just through the regular circulation of the disease that remains still in Spain. But we think that we now have the health capacities to manage this. Now, in terms of that, I just want to run through a very short list of key sort of learning items that we've acquired over these months here. So one was, and these are sort of the instruments to manage the disease. And by the way, I should begin by saying that at the end of March, it felt like a much more challenging issue because there was a lot of information missing about how the disease behaves. We studied very, very closely the cases in East Asia, a number of countries, so Singapore, Japan, South Korea, China. And we looked at how they managed the disease, but it was some of the issues that some of the tools that they were using there were not applicable back here. They hadn't gone through such a harsh containment process as we had here. So not all of the learning was there, but now we have a ton of cases. It's a much richer environment of comparative cases of management of this, of very similar countries to Spain or the US in terms of how our healthcare system works, our political system works, and a whole range of other issues. So in terms of tools, clearly early diagnosis is very important, and Spain has built an entire strategy around PCR testing and very rapid PCR testing. So the goal in Spain is to be able to test any case with mild symptoms.
Can you clarify what PCR testing is for people who don't?
PCR is one of the technologies that you can use, is one of the methods that you can use to test for the presence of the disease in a particular person. And at the beginning, this is different from rapid testing. These are these rapid tests that test for defenses against the pathogen. PCR actually detects active infection. It takes a little bit longer than the rapid tests for it to produce results. It takes a lab to be involved, and it's a little bit more cumbersome, but it's much more reliable as a testing methodology. And at the beginning, by the way, this was one of the open questions, right? Which method should we use? Should we just sort of carpet bomb the issue with rapid testing that we do very often, that it's not 100% effective, but can actually deal with many cases, or do we go for much more solid and resilient PCR? And the Spanish response, and this is true across a number of European countries, is no, we'll go for PCR. It's more costly, but it's also much more reliable. So our goal here now is to do early diagnosis through PCR for any case that develops any symptoms, hopefully within 24 hours of the onset of symptoms. So that's one very clear goal. The second goal is the isolation of cases. So once cases are diagnosed, they have to be isolated either in their homes, or if there is capacity somewhere else, in medicalized hotels or other spaces. That's also very important. The third would be the tracking of contacts of cases. So these are people that have been in proximity for some time of confirmed cases. We should be able to contact them, inform them, and have them self-quarantine, so self-isolate as well. And we're doing that in Spain through manual contact tracing. So literally hiring hundreds of people by the healthcare service that follow up on cases. There's a tech piece here that we can discuss if you want through apps. How much of this tracing can you do through apps? How much you do manually? But our approach to this is we're testing an app here in the Canary Islands in Spain, but we've built a net of manual contact tracing so that we don't so that that's there. It's in place irrespective of whether the app actually works or not. And there's a question about whether these apps are going to be sufficiently effective, particularly in rural areas and others.
So one question I have about this is, and of course the US is at a different point, I think, in getting control over the pandemic. But there are parts of the countries where cases are, declining, and where you could maybe see a transition to a system like this of testing and tracing. I think the concern people have is that, not enough people will really sign up to apps to be able to do effective tracing. And if you do it manually, as Spain is currently doing, the numbers of people that you need to implement a test and trace system just escalate, and it becomes too difficult to do. So how is it simply that the numbers are down so far now in Spain that it becomes manageable, or have you really developed new systems that people may be unaware of?
So the apps have a number of challenges. One is the privacy issue, although the Apple and Google technology, which basically functions through Bluetooth technology, and the data is never centralized anywhere, so it's kept on the phones. Phones basically smartphones share like a digital handshake once they've been in proximity to one another. And if you introduce in a certain app that you've been tested positive for the disease, it's your phone that connects to all of these other anonymous phones that it's shaken hands with through Bluetooth. So it's actually very decentralized and anonymous. So that piece, at least, we think that technologically can now be solved. The issue is the threshold of pickup of the app for it to be effective. It still needs to be determined, but it's in the 60-70% range. So actually, you need to have quite a dense pickup for it to work. And then for people that don't have smartphones, for people that are older and are not digital, for rural areas where the distance between people is wide, the efficacy of the app declines. So I think that most countries will build both capacities. They will try to unload as much of this onto apps as they can. And then they'll build this residual sort of subsidiary capacity on just the manual tracing. In Spain, just to give you an idea, this will probably entail hirings in the 15,000, 10 to 15,000 range of people. The UK presented a plan that was in the 18,000 range of contact tracers being hired by the NHS, by the National Health Service there, to do this. And the UK has also been testing an app, by the way, in the Isle of Man. So we've been following up on what other countries have been doing. The rest of the tools, and I'm just going to name them, social distancing measures work clearly in public transportation, in public spaces. Protection measures like masks and gels work. And by the way, the efficacy of masks was also something that was tested over time. We saw in East Asia a widespread use, but now we know for a fact they're very effective. So and it has to be everybody wearing masks. So in order for its efficacy to be truly high, sanitation and disinfection measures, just the cleaning and disinfection of public spaces, is another measure. And then the seventh and last would be the management of the border, which I know is something that is a key issue also in the US, which is even the places that managed the disease very effectively within their borders very quickly face a challenge of managing and preventing the import of cases from abroad. So, and by the way, speaking about the economics, which I'm sure we'll get to in a minute, this is one of the ways in which this disease very quickly mutates from a health, sort of producing a health crisis to producing a very deep economic crisis. And it's the mobility element that makes it basically have that leap, right? Because it's the contact point of this on the economy. One of its points, contact points, but possibly the most significant is that it hinders both internal and international mobility. And that for a country like Spain, for example, that is highly dependent on tourism, it's one of our key sectors, most competitive sectors. It accounts for about 13% of our employment, just to give you an idea, upwards of 12% of our GDP. Then this becomes a very significant issue, how we solve the border issue. But just to end this very first part on a positive note, it just feels very different from mid and late March. We now know that there's this battery, there's this sort of range of tools that you can use. We know of their efficacy. We know that if they're applied at unison and well done, you can get the numbers down. And you can manage this. So now we're in an execution problem scenario rather than an uncertainty scenario, which is where we were in the middle and late March, where we had so much, information and knowledge missing about how this behaves and how this is managed. And it feels a bit like that in Spain. We're aware of the challenge that we face now, but we're also aware of the distance that we've covered since early mid-March, when we really detected the scale of this and the challenge of this.
I think this question of mobility and borders is a really important one, because one of the key differences, obviously, between the European and the American response to COVID-19 has been the fact that European countries very quickly all introduced border controls in March. And that's something that's simply unthinkable within the context of the US. The United States is, massive. It's half a continent, and therefore it doesn't really make sense to talk about a US outbreak as opposed to outbreaks happening in multiple places at different times, at different speeds, and obviously interacting with each other. And obviously introducing border controls between US states or counties poses, dramatic constitutional and practical challenges. Nobody has even thought of it as a practical matter. Although I think New York has now introduced quarantines for people coming from states that are more affected by COVID-19. But I think just to move the conversation on a little bit, might be useful for you to talk about the economic impact of all this, and especially the Spanish economic policy response to the crisis. So obviously, this is an unprecedented situation. It's an adjective that's been overused lately, but it really is unprecedented to sort of put the economy into a deep freeze for 3 months. And I think, one of the things that Stan has been arguing for is that it's really important in this situation to make sure that the employee-employer relationships remain alive through that period, so that once lockdowns are lifted, we can go back more or less to where we were. And so I was wondering how you were tackling that in Spain, policy-wise, how effective that's been, and what are the sort of early signs of a recovery that's coming.
So thank you. Just a quick comment on the mobility, and then I'll move into the economy piece. We have had to do so many unthinkable things as part of the management of this pandemic. So, basically having almost 50 million people, the totality of the Spanish population confined to their homes, except very fundamental services and industries, that was almost unthinkable. It was unthinkable before the crisis, right? And yet it was needed, and it has proven to be very effective. On the mobility piece, we decided, and I think this was an important decision that was made here, that the de-escalation, the exit strategy would be conducted with this asymmetry, geographic asymmetry. So our regions, and in the case of Spain, we chose the province, which is, it would probably equate in the US to a sub-state level. I'm not sure if it's the counties but a sub-state administrative unit. And it would be assessed at the level of the province, and provinces would transition from phase to phase. More advanced phases would mean more mobility and more openness to economic activity or others. And mobility between provinces would be severely constrained. In order to isolate each province and limit the risk of basically transfer of the prevalence of the disease. This proved, I think, to be very effective, and it was a very good way of being able to assess the actions of each of these regions. On the opening of the border, just to give you an idea, and just a very quick update on how the EU is thinking about this, what epidemiologists tell us is that the essential criteria for the opening of mobility is that you restore mobility between regions or countries that have similar levels of prevalence of the disease and controlled levels of the disease, because movement between those two spaces doesn't entail an increase in the risk of transfer of the disease. So I think this issue of using mobility as a tool to control the spread of the disease will be very central. And I know this is, I think this is very hard to implement maybe within the US, but I'm almost certain it will be part of the discussion as to which countries does the US open its border or not, external border. On the economy, so
Manuel, before we move to the economy, there's a question from our audience on the extent to which the US and Spain have exchanged information on how to deal with the pandemic, and whether, whether you feel like collaboration on that front has been fruitful.
We've been in I myself, I haven't been in touch with US colleagues on the issue, but I'm certain that there have been contacts through the embassy and through our health ministry. We are part of recurrent and very important fora where this issue has been discussed. From the foreign ministry, we've kept in very, very close contact with our European colleagues, fundamentally Portuguese, Italian, French, German, UK colleagues as well. So we were in close contact with the de-escalation committees, so the teams that were working on the deconfinement strategies across Europe to try to exchange best practices. But I feel the exchange of information has been quite dense just across the board, because I think everybody feels that this is a real global public good. I mean, there's no benefit to anybody in not sharing what we know and what we've learned about this. We created, by the way, in Spain, in the foreign ministry, something we've called the COVID-19 International Observatory that was very useful. It's basically a team of folks in my part of the ministry, in the strategy division within the ministry, that receives information from a number of countries that we've identified as references for how to manage the disease, the measures that we're implementing on the economy, on the education sector, on the border. And we produced these brief notes on best practices around the world. And these we've shared internally to decision makers in Spain. But most of the information is readily available, and everybody is willing to share that information. On the economy, so we've been very aggressive in Spain on the stimulus package on a number of fronts. I think it has equated around 20% of GDP if you add the totality of measures, a little bit upwards of 20% of GDP if you add all of the measures implemented. There's an entire bucket of measures around liquidity, so that a liquidity crisis in businesses doesn't turn into a solvency crisis, basically, and that leads to bankruptcies and closures of firms. So large amounts of money have been directed at public funding and public guarantees to fund loans and business operations in the short term. A large chunk of funding has been directed to what you referred to as something that Stan has been speaking about, which is basically we call them ERTEs in Spain, and they're a category of it's not an outright layoff of workers, but you put them in a specific category where they're still not, they haven't been laid off. Part of the cost of keeping them on the payroll is assumed or taken over by the state, and they can be then deactivated, these ERTEs, and people can go back into their normal employment later on. And we're in the midst of a conversation right now in Spain as to the length of these ERTEs, because there's a public budget dimension to this. We've been part of, and this is last comment on this, and I'm happy to answer questions in more detail if I can. But on the European front, we've been extremely active on the establishment of an ambitious EU recovery fund. This is because of two reasons. One is solidarity among EU member states, but more importantly, actually, even than solidarity, is that if we are to keep the European single market intact and a level playing field in Europe, it's very important that states don't find themselves with very different fiscal margins of action when it comes to helping the recovery. Because we've lifted the state aid rules in Europe for many industries, so that in a very short period of time, and exceptionally, our states can come in and pump in funding and save some of their key industries. So if you add to that different fiscal margins, that can really lead to a very unleveled playing field in Europe. So Spain and others have been making the case, and actually Germany is in agreement, and a number of countries from Northern Europe are in agreement on this, that this recovery fund should be ambitious and should allow everybody to take the necessary measures to get out of this as soon as possible.
Given the current contours of that recovery package, so what is it, 750 billion euros, some of them in loans, others in grants, and financed by sort of mutualized form of debt. Are you happy with that, or is it enough? Is it Europe's Hamiltonian moment? Is it not enough? And where do you see this conversation going over the summer? Where I think it's going to be decided what the exact sort of disbursement mechanism is going to look like.
I think it's a very positive and a very good starting point for the discussion. This is the formal position of the Spanish government as well, that we're very happy to enter the discussions with that backdrop. And there are very important principles that have been accepted, right? One is that the EU should act and can act, that it should be large in scale, because those figures are in fact large. I mean, it will almost double the multi-year financial framework that the EU approves every number of years. So, I mean, it really gives the EU budgetary firepower in a significant way, and we think that's positive. But it's still responsible in the sense that it's very clearly tied to the reconstruction efforts linked to the disease. So I'm not sure how Hamiltonian it is, in the sense that it is constructed as a one-off. I mean, it will set a precedent for the EU acting in cases like this, but it's not a structural change to how the EU is funded or how the multi-year financial framework is, which is the EU budget, is constructed and dispersed. I mean, there's this singular effort around the reconstruction fund that is a one-off, and that it should be and should be spent on measures, expenditure and investment very linked to the health crisis. So on the one hand, I think it's extremely positive. I don't think we should read too much into how it changes the nature of the EU precisely because of that one-off nature. Just a quick comment on this. It might be too 30,000 feet, but I think it's very important, because the way we see things now is we have these two paths of recovery, economic recovery ahead of us. One path probably produces or deepens some of the issues that we saw in our economic model in the past, decade or two, which have to do with a rise of inequality, have to do with environmental sustainability issues with the model. And another path, in the case of Spain and some other countries, also a model where we needed to invest a lot more on digital and actually being productive and competitive. And the other path takes you down this much more digital, green, inclusive path. And it takes investments and it takes structural reforms in a lot of places. And I'm not sure if the sort of trying to simplify this in these two very binary paths lessens the validity of the argument. I mean, I think it's almost as simple as that, right? I mean, we have these two routes. And what we're trying in Spain is to, A, build a European consensus so that this is feasible and possible, and two, build a national consensus within Spain. There's a very important reconstruction commission in our parliament that is working out this consensus. But if we manage to combine these two, in fact, we might be able to turn this very challenging situation into an opportunity in the fall, where we combine these two levels of action and we reproduce a cycle that was very beneficial to Spain in the 80s when we joined the European communities, where we had political, economic, and budgetary margin that came from above, from the EU level, and a very strong national consensus to advance the structural reforms. And it led to a lot of growth and convergence with EU partners. So that's sort of the positive view that this road might take us down on.
And I think it's important to emphasize just how large these EU level efforts are in budgetary terms, right? So and Manuel alluded to this, the number that Dalibor mentioned, $750 billion, that's about the budget of the entire EU for 5 years, right? So that's really a tremendous effort, right? If you think of it in US terms, right? If the budget of the federal government is 15% of GDP, this would be the equivalent of suddenly spending 75% of GDP on a recovery fund. And so I do think that, even though it's in some sense a one-off, it's a one-off of such tremendous size that I do think it's symbolic in that sense as well. So obviously the full EU response is still in the works, and we'll see what happens there. I wanted to move next to the sort of global dimensions of international cooperation. There has been a lot of criticism of the World Health Organization coming from the administration here in the US. And so I'd like to hear where Spain stands on that. And then there's a number of other frameworks of international cooperation that I'd like to talk about. But let's start out with the WHO. Do you think it's functioned well? Are you worried it's controlled by China to an extent that is deeply unhelpful. Where do you stand on that?
Maybe on that note, there's this interesting tension that Manuel already alluded to earlier between the unprecedented amount of international and transnational cooperation and information sharing. We see it in these efforts to develop a vaccine and in sort of exchanging information. And at the same time, there's this sort of sense that the pandemic is sort of unraveling international institutions. And I think the WHO is really at the center of this. So it's going to be interesting to sort of watch how this unfolds. Sorry, I didn't mean to derail.
I think you're absolutely right, and in fact, I mean that's the right point to start a response, which is there's this big contradiction, right, that this pandemic is sort of revealing or unveiling, which is on the one hand, it clearly asks for much better global cooperation on the response. So we need better information systems that are much more agile. We need better exchange of best practices mechanisms. We probably need the capacity to respond collectively to these things, mobilizing resources and other. By the way, there's a supply chain dimension and supply of medicines and medical equipment issue linked to this, because our supply chains were very stressed and in some instances actually collapsed. I mean, some of our normal chains of supply of very critical materials and equipment didn't work when they were meant to. So we can also talk about that. And healthcare is so evidently a global public good when it comes to a pandemic, right? So if you talk to any health expert in the world, they will tell you that if we are to recover, we're going to go back to normality, you're going to need for this disease to be well managed and under control in almost the totality of the world. Unless that is so, you're going to see disruption to travel. You're going to see, these cases, this explosion of cases here and there. You're also, by the way, more exposed to the mutation of the disease somewhere else and then coming back through other channels. So this is a clear case for this. Now, the initial reaction was very national. So if you look at the financial measures that were taken, if you look at the border issues that we were just discussing, if you look at the extraordinary health measures that were taken, most of them were taken by national governments. And the multilateral world, it took some time for the multilateral world to catch up. But we think that was necessary, but it's not sufficient. So what we're developing here in Spain is an action plan on global health governance, and it has a number of layers to it. So it has a WHO layer, which basically calls for reform of the WHO for it to have a broader mandate and more resources and more capacity to act in cases like this. It has by the way, it's not just the WHO, there's a whole ecosystem of multilateral institutions that manage the relationship between humans and the agricultural environment, or animal ecosystems and the interaction between animal and human ecosystems, which, by the way, were vital to the origin and spread of this disease. It has an EU layer to it, so not just WHO and multilateral. So Spain has now proposed a number of things at the EU level. For example, we suggested that the EU considers conducting stress tests on national healthcare systems, just like it does in the financial sector, so that we can test whether national healthcare systems are ready to face another shock like this in the future. We've also suggested the creation of an emergency unit that can be deployed at the EU level, a little bit along the lines of a unit we have in Spain called the UME, which is it's part of our armed forces, UME, and we can deploy it in case of emergency. We used it in this instance. It has another layer of action in the case of Spain, which involves our development policy, and we just crafted, it will be public in a few days, a whole international development strategy linked to COVID-19 and healthcare capacity building. So we funneled part of our development budget into building specific healthcare capacity in places, and actually capacity to deal with COVID, because COVID asks for very specific things, right? Critical care capacity, ventilators, protective equipment. So it's extremely surgical in terms of what you need to really strengthen in your healthcare system. The testing, the diagnosis methodology requires very specific pieces of kit and chemicals and reactants and things like that. So for us, one of the key lessons out of this crisis is we need to strengthen a global governance architecture when it comes to healthcare. And that has many layers, and we're working on all of them at the same time. I just, we hope to be able to build an international consensus around these things so that we can move forward, because we really think we'll be much safer if we get to work together in future cases like this, rather than having to face them alone.
So you briefly mentioned that there are supply chain issues that relate to the current situation. Of course, the U.S. has been on a more protectionist track over the past few years, and I think a lot of the people who want to continue down that route and who want to, use tariff and other policies to get more activities reshored back to the U.S., I think see an opportunity here to really push for those kinds of policies. How concerned about that are you? How worried are you that the WTO is basically fundamentally broken at this point? In large part due to U.S. sabotage of the appellate courts, but nonetheless, it's an issue, and it's not totally clear to me how that's going to get fixed. Obviously, within the EU, it's hard for things to break down that way. But the EU itself is negotiating with Brexit in this environment, with the UK on the future relationship after Brexit in this environment. How worried are you that that international trade order, and I think levels of free trade that we've taken for granted over the past generation, how worried are you that those are just completely breaking down? And what are you doing to deal with that?
So when this crisis started, we conducted I asked for a number of foresight papers to be crafted on the impact of the pandemic on global affairs and global economics. And we're following the topics that we're touching on in this conversation actually fall very cleanly into the buckets of issues that those studies revealed as very central. One of them was this idea of the crisis accelerating or accentuating pressures for deglobalization to deepen, right? Because of this issue of supply chain risk and it being revealed. In the case of the EU, we even had cases of supply chains ceasing to function within the EU, and that just gives you a sense of how stressed and how sort of anomalous the international market became, in particular regarding these very specific products, right? Protective gear, masks, ventilators, and things like that. So there's this tension, right? And I think there's a healthy part to this debate, and there's an unhealthy part. So the healthy part basically calls for us to look at our strategic autonomy and to think really hard about our capacity to face future shocks like this. And this is one of the learning pieces of this crisis, which is, how ready are we to face another shock like this? And there, Spain is now thinking about this autonomy piece and setting up identifying a number of critical industries, firms, and critical products, and determining through a number of protocols our capacity to mobilize production of very important things when it's needed. We might also end up conducting both at Spain and at the EU level. There's an EU strategic autonomy initiative now that has been sponsored by France, Germany, Spain, Denmark, and a couple of other countries. There was a letter from our prime ministers and chancellors to the president of the European Commission about this about 2 weeks ago. We might end up conducting, again, stress tests on our supply chains, which we can do. There might be a push to reshoring part of the production or near-shoring some of the production. So all of that, I think, is healthy to some extent, which basically means that we extract lessons from this and we're more ready for the next shock. Now, when you take that to a general sort of impeachment of the trading architecture, then I think that's where I think Spain begins to worry, and not just Spain, but a lot of the European countries, because we feel that, we're free traders, right? But fundamentally, we think free trade is good for the economy. It produces growth and is positive. We think that the WTO and the trading architecture should include concepts of sustainability and others into the future generation sort of trading agreements and others. But overall, we think that it's an architecture that has worked and has brought growth and prosperity. So we want to, we want to have the EU sign new trade deals. with Mercosur and with others. We support other free trade arrangements and areas being created in Africa, in Latin America, in East Asia, in other places. I mean, this is the EU and the Spanish position, and will continue to be. And on the WTO, we think that it is much better to think about how you reform the WTO to make it more agile, more effective, rather than shut down the WTO. And we're in the process of precisely putting forward proposals on that front.
This all sounds exceedingly reasonable. The sort of problem there is that really the EU can't do all these things alone, right? Whether it's the reform of the WHO, on which you would like to build a international consensus, or keeping the non-discriminatory international trade environment alive. I think you need other countries, other powers to sort of keep the agenda pushing forward. So that really opens the question of transatlantic relations, which are probably not in a great place right now, and also China. And I know that Spain has been more circumspect towards China than some of the other European countries. You didn't sign the MOU on Belt and Road Initiative. You have a framework for evaluating strategic implications of foreign investment, etc. So if you could maybe talk about sort of how Spain is looking at the future of transatlantic relations in this context of reforming international institutions, and also the role of China and the challenge it poses.
Yeah. So it's a much more variable geometry than it was in the past when it comes to building coalitions for reform and for the upkeep of some of these institutions. So we sometimes agree with the U.S. administration. Other times we disagree, and we need to find different interlocutors and different partners when it comes to reforming some of these. So that is true. That is the case. In the case of the WTO and the WHO, for that matter, there are a number of partners around the world that see things through quite a similar lens to that of Spain. In terms of the WHO, there was a very successful funding round recently to increase funding for the WHO and its crisis response. And if you look at the countries that contributed, that gives you, it's a very good proxy for countries that support the WHO and its strengthened role when it comes to managing, circumstances like the one we face today. China was there, all of the European countries were there, a number of very significant Latin American countries were there. Something very similar happens with the WTO, right? The WTO is in effect now, the EU is in effect setting up a number of arrangements within the WTO that will allow the organization to function, and the members of the organization to continue functioning almost as they were, without those that do not want to be part of the conflict resolution mechanisms of the WTO and others. So it just means that we need to be more creative when it comes to building coalitions and alliances for reform and upkeep of these institutions. Regarding China, I think Europe has been very explicit now about how it sees its relationship with China. So Europe has last year identified China as a systemic rival. And that was a very serious language coming out of Europe, but also as a fundamental partner when it came to a number of topics, from climate change to trade to global migration to, it's an enormous range of issues that we have open to technological development and exchange that we have open with China. So I think Europe is sort of constructing a position around this, where we're fully aware and we're demanding and we're honest with the Chinese interlocutors, basically around issues linked to human rights and to democracy and to political and civil rights in China and in Hong Kong and in other places. But at the same time, we acknowledge that they're key and fundamental partners for Spain and for the EU on a whole range of issues. And that's roughly where the issue is landing on the European front. But just on the WHO and the WTO, they're essential interlocutors for us as to what we want to do with these institutions.
So on those two institutions, it really sounds like the EU is to some extent building a separate international order that doesn't involve the US as directly. That's of course much more difficult in other areas. And so over the past few years, we've seen tension around the organization of NATO and the US contribution to that. The EU and the US basically parted ways on the Iran deal. The US approach, I think, vis-a-vis Venezuela has been much more aggressive than the EU's. And so how do you see the management of those three specific issues? So NATO, Iran, Venezuela, because there it doesn't seem feasible to basically just ignore the US and try to work around it, right? So that, I think those are much more challenging issues, and I was wondering how you think about that.
But you know, I mean, it's I used to run a program on transatlantic relations, and I studied transatlantic issues for a long time, and it's always been a very intense relationship, and there's never been full agreement on almost anything. I mean, this idea that that there was a period when, you know, when we agreed on everything is fiction. No? We share, and this is the starting point of the discussion. This is the backdrop to the relationship. We share extremely deep and well-rooted values, and I think there's an Atlantic civilization in the deepest sense of the word. I mean, the values of freedom, of democracy, of equality. I mean, these are very, very deep and significant values. And you realize when you travel around the world and you get to know other countries and other cultures, actually how different other places in the world are. Sometimes we forget across the Atlantic how much we share, but it's really worth visiting other places just to realize how much we share. So I think that's the backdrop. Now, the way those values are manifested specifically, you know, in interests and in foreign policy actions, there's never a perfect overlap between, or very rarely there has been, between Europe and the US. So it's an issue of managing those differences in a constructive way, but always bearing in mind that we share that bedrock of values. On NATO, basically the disagreement on NATO is around part of the funding piece. This is not exclusive to the Trump administration. I mean, it has been said now. I mean, I think you can go back almost to the Kennedy administration, and it was already sort of being mentioned. The last, one of the most emblematic speeches on this was Bob Gates in Brussels, his last visit to NATO. I mean, he couldn't be more explicit, and he was defense secretary in a different administration. And I think it has to do with two visions and interpretations of security and how security expenditure should be assessed. And in any case, Europeans have now agreed to almost the totality of US demands on this, and most of them are on a path to arriving at around 2% expenditure on defense, including Germany, by the way, which is by far the most significant because it will take their defense budget up by quite a bit. So on the NATO front, I think it's a much longer issue than this administration, and it's been there almost from the birth of the organization. On Venezuela, it's we again, it's interesting how this ends up showing up. So it is the shared values that serve as a backdrop to the policy in Venezuela, which is identical actually in terms of the ultimate goals. So both Europeans and Americans, we both believe, this is definitely the case for Spain, that Venezuela should come to a political arrangement and an agreement between the government and the opposition that should lead to elections, presidential elections, ideally that are democratic, fair, and that lead to a political reconciliation process. And I mean, I think this phrase could be signed by almost anybody in the State Department and in chancelleries and foreign ministries in Europe. Now, on the strategy and the tactics, the divergence is not that large. I mean, it's really not that enormous. Both the US and Europe have given wide support to Guaido and the opposition so that this transition can take place. Both have put pressure on the regime through that support and others, so that dialogue and transition can take place. So it's really on the margins of the issue. We just celebrated in Spain a very large donors conference for Venezuela, and the US took part in the conference and actually was one of the most generous countries when it came to supporting Venezuelan refugees refugees and migrants displaced by the situation in Venezuela in third countries. So again, constructive. On Iran, I think we do see differently. I think on Iran, with this administration, there's a different point of view. I think Europe is very committed to the Iran deal. We think it's positive. We think it pushes Iran away from a nuclear weapon, and we think we should stick to that agreement, and we should stick to the commitments that we made both to Iran and to the international community around that. And the U.S. doesn't see it. This administration doesn't see it that way. And there, I think Europeans, we need to really work hard to try to bring the Americans around, because we're still convinced that agreement is the best option we have for peace in the region. So I think perhaps of the three issues, the Iran one is the one where we really need to try to work hard to build a common position again. Particularly, I think, for the good of the region and stability there. So out of those three, I would say Iran is the one where we need to work.
There's been this long-standing refrain among transatlantic watchers, namely that the US doesn't fully appreciate or understand the European Union, that the attitudes in Washington towards the EU would range somewhere between indifference towards hostility, and that going forward, like if you want the transatlantic relationship to be more encompassing than these traditional questions of NATO and maybe energy and others, we need to that the US really needs to take the EU seriously as a body. It has to sort of move away from this bilateral approach, because if you want to tackle things like China and trade, it's the EU that has many of the relevant tools. And on the other hand, the EU probably should start giving Americans more reasons to be taken seriously as a coherent global body. So what do you see as a sort of potential scenario going forward for sort of revitalization of this sort of institutional link between the EU and the US? I was wondering, if a forum, a regular meeting space for sort of dialogue between foreign ministers or heads of states with the US president or US administration would be useful. I don't think we've seen many of those in recent years, and whether Spain is trying to push for something like along those lines.
So on that topic, I think there's a lot that the EU has to do, and we need to deepen the project on the EU side, right? So we should do a lot more, I think, on a common foreign policy, a lot more on a common security and defense policy. This has been the position of Spain, and I think the more coherent and consistent an international actor the EU is, I think the more fruitful and intense the relationship with the US will be, because having lived in the US and known US strategic thinking, and I think sometimes it's a bit of an enigma for US policymakers how the EU functions and what are the EU's sort of real deep and sometimes very simple strategic choices are, right? And it's sometimes hard for those simple choices to emerge out of a machinery that is complex, that is built to basically construct these consensus among a very large number of countries. But the EU has taken enormous leaps in that direction in the past, I would say, decade or two. So if you look at, from 1998, when the San Malo Declaration was signed in Europe, which is basically the birth of the common foreign and security policy, which is the foreign policy sort of toolkit of the EU, to the common security and defense policy, which is the security and defense bit of the EU, to today, you would see enormous advances. We now have a high representative, which is basically like our foreign minister. We have a European Defense Agency, but there's still a lot that needs to be done, particularly, I think, on the strategic thinking bit. So my recommendation would be for Europe to get its act together and start acting, I think, as a much more serious geostrategic actor, and I think that would have an effect on transatlantic relations. As to the topics and mechanisms to deepen that, if I had to choose one issue where I think dialogue should be deeper, it would probably be the rise of China and how we deal with China, both from a economic, diplomatic, and otherwise, because this is the most significant development in of the 21st century when it comes to geopolitics, right? The rise of this enormous economic and security actor in Asia. So if we can't construct a transatlantic consensus as to how to deal with this, then I think the relationship will be much weakened. So if I had to put an emphasis on something, I'd probably say it would be that issue. And I think we should have a recurrent forum of some kind where this is discussed at an EU and US level.
All right, I think we have time for one last question, and I'm going to take one from our viewership. What is Spain's position on the election for president of the Inter-American Development Bank, which has been in the news a few times these past weeks?
We don't have. I mean, we're still waiting for the candidacies to come in. We know that there will be a U.S. candidate that has now been announced, and we're going to basically assess the candidate on its merits. So we haven't yet decided which way we're going to go on this. I think it's slightly early for us. We're still waiting to see other candidates that come forward, and then we'll make a decision on that.
Excellent. So, well, that was a good quick answer. If you can give us 2 minutes on whether you believe that Brexit will ultimately hinder or stimulate the fiscal integration of the European Union, I think that would be a good way to close out. Yeah.
I mean, I've always thought, I lived in the UK for a number of years, and I've never liked the idea that such a significant member state would leave the EU. I think it's at the end of the process, it depends on how we manage the Brexit negotiations, but I think we'll all be worse off after the process as compared to before the process of exit. Now, the work that we're doing is to try to make sure that the least value is destroyed in the process of Brexit. But I think that, again, if you look at the state of the world, and if you look at the scale of international actors in the world, the only way in which European countries can be relevant and can see their values and interests well projected around the world is through scale, and I think that is basically the EU project. So overall, I think that it has always been hard for me. I had a British friend that kept on asking me, "You have to give me one positive read on Brexit," and it was always very tough for me to give a positive read on Brexit. But one positive read might be, in fact, that it allows us to move forward on a number of fronts in EU integration. So fiscal harmonization might be one, possibly on the corporate taxation front earlier than on income tax, because of the competition and level playing field I mentioned to it, possibly, quite possibly, and most likely on the front of security and defense and foreign policy integration, with some involvement of the UK. So if you look at, for example, very historic decisions on not moving forward on security and defense integration, like, for example, the vote on establishing a permanent European headquarters, that didn't go through with the negative vote exclusively of the UK, right, when the UK was a member. So perhaps some of these things can now move forward because the UK is not on board. But the number of negative things, the list is so much longer, right? I mean, the UK is a major foreign policy actor, is a major trading power. It has a very significant military. It has one of the best educational and research ecosystems of the world. It has one of the most interesting and deep cultural ecosystems of the world. And it shares so much with the EU. I mean, it's one of the major trading partners of the EU. The EU is by far the most important trading partner to the UK. So all of those things in my mind outweigh this, and I hope that in the future there's some opening for this relationship to be, as deepened, even possibly to the extent of reversing a decision like that. But that's just some hope for the future.
All right. Well, on that hopeful note, thank you both very much for joining us. Thank you to our audience, and have a good rest of the day.
Thank you. Thank you, everybody.
Thank you.